I want you to go to Medicare.gov, not Medicare.com. Medicare.com is a New York insurance agency who would love to keep you on the line all day. Okay? Medicare.gov. Now, we normally don't like to say the government does anything good. This is an exception. There's too much information here. You can narrow that information. You can set this up as my Medicare.gov. You can actually create your own portal within this. I would advise you to look into doing that. Okay? But this is where all my information comes from. We come in, we find the drug plans, and then you have two options. You have an option just to put in your zip code and do a general search. That's what we do, okay, based on zip code. Or down here at the bottom, you put in your zip code, but now you put in your new Medicare number. What that does is it then helps to start narrowing what's out there to you, because it sees you in the in the Medicare records. All right? Everything's based off of your number. Then we're going to ask a couple more questions. They're not being nosy. They're trying to help you determine what you want to see so that you don't see things you don't want. The third page, step 2 is in their way, is to enter your drugs. If you say, no, I really don't want to enter my drugs, you click that button, the next window that pops up says, are you crazy? No, it doesn't. It just says, are you really sure? You might want to do this. I would encourage you to do this. Do it once, because if you do it once, this is going to populate an ID for you. Write that ID down. Write down the date that you're in there. Because the next time you come in, you put that ID in, guess what? All my drugs are there. I don't have to enter them again. All I then have to do is make changes. Okay? It is a very nice item. I had a gentleman that I was helping a week ago. He handed me his bucket. Okay? There were 20 pill bottles in there. All right? I'm relatively quick with a computer. That still took me a half hour. Okay? So you don't want to have to do it over.
So just say you only take one drug. Do you really need to do that?
Yes.
You'll do.
Yes. Here's the reason. Again, number one, one drug means that you're purchasing a prescription drug plan from somebody, either in your Medicare Advantage plan or a PDP, okay? You need to be able to determine, is that drug in my formulary or isn't it? Is my drug generic? Is it changing? Because you're only on one, and that's fantastic, or you're not on any, and that's even better, but at some point in time, you're going to get something added. And then I can go back in here and I can make some decisions. Oh, that drug, that's a tier 4. That means I've got a $415 deductible before I get that drug. Okay?
So if you say you're already on Medicare taking it, do you need to do that every year?
Yes.
You need to enter that information.
It's the drug's going to be there.
Right.
As long as you have that ID, it's going to carry over for you.
Right.
Okay? But it depends on the letter that you receive. If you receive a letter from a standalone drug company that your drug is no longer on the formulary, or they're discontinued that drug, some manufacturers discontinue drugs, where do I find my equivalent? Well, fastest way to find my equivalent is right here. Okay? Yes, you can call the insurance company. If you really, I had a slide on here with a lady on the phone, and I used to make the comment that when she started that call, her hair was brown. Okay? So you have to be careful when you're doing that. So you come to this page, and there's two things to think about, as you were talking about. There's 27 standalone plans. If that's all you want to look at are the drug plans, only click that box. If, however, you're looking at Medicare Advantage, then you want to click those two, because there are 11 plans that have drugs included. There's 5 that don't. You want to be able to compare them side by side. If you're a special needs, if you have COPD or diabetes, you want to click the box over here for special needs plans so that that'll pull up for you. So I've entered my drugs, reluctantly, but what does that give me? It's going to give me all, in this case, all 11 of the Medicare Advantage plans so that I can determine, are my drugs in the formulary? What's my cost? How does all that work? You can also click this box here, and if you click 2 other boxes, you can look at 3 plans side by side. And that's really good again. Now the worst part is, if you don't like those 3, you got to go back and start over and click 3 more. Okay? But that's not a horrible thing, it's just that's the way the program is set up. Okay? Now, were you asking about did you ask? Ratings. Here's our ratings. So in this case, this is Advantra with Aetna. They have an overall rating of 4 out of 5. Their drug card is a 4.5 out of 5. So their drug card use is very good, their drug plan. But their health plan is only a 3.5. So what that means is that members have reported some problems. Members have reported, good and bad, and providers have reported good and bad. They're getting a middle grade, 3.5. Okay? It's like your son coming home with a C on his report card. Okay? He's passing, but he probably could put a little more effort and have a B. Okay?